My name is Angel. I'm a nurse at MedStar Washington Hospital Center. This project is very near and dear to my heart. As a new nurse, um, I was just as prone to burnout as my peers were, and finding a way to help each other through some rough times and save us from losing some really great nurses. This project seeks to identify people at the highest risk for burnout and sort of alleviate that critical stress response and get them back to a baseline where they're able to perform um, after a stressful incident. Um, in the project, we use badge buddies with the stress first aid model on them, as well as an attachment where nurses could move it to identify where they're at. It does help because sometimes it can be challenging for people to articulate how stressed out they are, or that they need help, or they might not even know who to ask for help. So we use facilitators to sort of stand watch and identify people who are moving from that green to orange, yellow to orange to red zone. Um, and the facilitators at that time would try to either intervene themselves or find someone else who was available to intervene. Um, it could be as small as taking them to a private room for a second, letting them take their mask off, wipe their eyes, pull themselves together, reassuring them, comforting them, and helping them keep going without letting that stress response keep building up. We all know that release is important. And so we try to focus on making sure we could be there for one another. It relied on senior nurses, leadership, as well as other new nurses to be the facilitators from day to day, volunteering to kind of step up and intervene when they see someone having an issue. So it's all just a fancy way of saying it was just nurses helping nurses and taking care of each other. We are great at taking care of patients, not great at taking care of ourselves. So putting it in a form where we're able to take care of each other, I think really did us a lot of good. And this has a potential for really good impact, if used over a longer time period. Yeah, so that's it. Reach out if you have any questions. I am happy to help or fill in any blanks. Thanks.